My health is my focus, and my body is nobody's business but mine.
Honestly, I never heard this.
Okay. Okay, so thoughts. Okay, I see your hand and say your name for me, huh? Trayana. Okay, what do you got, Trayana?
I think the message is to people, also bigger people, and then also people worrying about people's health, like judging them, like stop judging them.
Okay, great job. So you found the two audiences. There are two separate audiences, individuals who may be living with this condition of obesity and individuals who may be criticizing, okay? What you're doing is what we call audience segmentation, where you're identifying the audiences and the specific messages that are either designed or that are resonating with that particular group or population. All right? Anyone else want to add?
Just because even if you're trying and you still can't lose weight, it's not necessarily your fault for that fact.
Okay, so like maybe if you try, so to help some people with self-blame, because that is very prominent amongst individuals with different chronic illnesses, is blaming themselves. And while it's okay to take accountability, when we self-blame, sometimes we get in a state where we call helplessness, and then we don't do anything because we feel like there is no way out. So that is a really important point that we do have to tap into when we're talking about health conditions, especially chronic health conditions. And in this era where biomedical interventions are doing exceptionally well in addressing obesity, we're also already seeing what we call backfire or unintended consequences, where now the individuals where these medications, were designed for, we're now seeing folks who don't necessarily need them, pursuing them because of the pressure to look or conform to a certain type of aesthetic, right? And so what happens is, for Eli Lilly being a pharmaceutical company, they are at the forefront of the medications that are treating obesity and diabetes. So this PSA was also a part of what we call corporate social responsibility, where they recognize that some may be misusing their medications, and let's refocus on the ultimate goal of these biomedical interventions, which is to really treat and assist individuals who need it.
All right. Stuff like Ozempic.
Yes. Absolutely. Okay. All right. Did anybody else want to comment? And so I will just, yes, please.
By the way, Lilly makes Ozempic.
Yes, they do. So this is a part of their CSR, as I mentioned, corporate social responsibility, to say, hey, we know that we're providing these medications. The goal was to treat obesity and diabetes. We recognize that other folks may be using it or engaging or pressuring others to utilize it, but we want to take our own responsibility in addressing the issue, right? And that's the difference between a PSA and a commercial. Because if I show you a commercial for Ozempic, it looks much different than the PSA that they put out, right? So being aware of those two things, always also being aware of who is the messenger of this PSA. That's really important. And not even just for PSAs, any communication messaging you come across, always ask yourself, who is the messenger? The purpose of wondering and wanting to know and being curious about the messenger is also understanding the intent, right? Why did they create this content? What stake do they have in this issue that made them want to create, right? And so being aware of the messenger is a critical component of health communication. I'm going to jump us into our next PSA, same thing. What is the message? Who's the audience? What is the issue? So give me just a second.
It's time we draw the line and put an end to the abuse. Brought to you by the NCAA.
Okay. What are our takeaways there? Okay, Xavier?
Well, the announcer wasn't so much as an actual person as it was like, I want to say the generic sports announcer, like sports commercials or something like that.
So they leverage that in the PSA, a common voice or a sound or aesthetic, okay? Any other thoughts? Treon?
I think the message was to people who like bet, they bet and they be having anger issues because they lose their money. Like people who have a hard time with gambling.
Absolutely. Okay. Absolutely. Yes.
I saw people online, like when it comes to some of like the big games, they'll put like their whole savings account on the parlay or the bet. And I'm like, you would rather take a chance and be homeless or like, you know, just risk everything that you have right now just for a chance.
Yeah.
Like, I don't know, so yeah. But I'm pretty sure there's probably something with it providing dopamine when you know, win the money, so it gets addictive. And it's just crazy, like $47,000.
Yeah. Yeah. And I'm gonna dig into it a little bit deeper. Yes, and can you say your name for me?
Jazmyne.
Oh, Jazmyne. Okay. I won't forget. Okay.
No, it's not. Okay. I was gonna say, I think the audience is more towards like the fans.
Okay.
And like to basically say like, don't hate the players, like don't hate the athletes, because they're not the ones telling you to like bet on them. So basically like that's just an internal decision for yourself to put money onto these players. And instead of being mad at them, you should be mad at yourself, because no one like influenced you to make that decision.
Right, absolutely. So don't take it out on the players, right? Don't bully and attack the players, okay?
They use a lot more like directive, well, what's the word? They use a lot more personal words. Like in the last PSA, well, yes, the guy was talking. In this one, they were pointing it at you. They were calling you out and using a bit more aggressive language.
Yes. Very good observation. We call that an explicit appeal, where it's very direct. You know exactly who I'm talking to. You know exactly what I'm saying. Versus an indirect appeal, which was what we saw in the first PSA, where he's addressing this issue, and to an extent he's saying, you thought I did this, you thought I did that, but he's not telling them more explicitly what they should be doing, right? He's saying what he's going to do. So you're right, there was a difference in the appeal, and depending on the issue you're trying to address, you may find one to be more advantageous than the other, right? And that's when we get into all the research and what's effective, et cetera, and I won't take you all the way there, but okay, Avery?
Does this have anything to do with like ethos, pathos, and logos?
Do tell.
She said, explain why you act. Those logos, man. Like, why do you think that?
Because you're speaking to the person that's showing the video too.
But what you think?
Chat, I don't know that. That's why I asked multiple. That's why I was asking a question.
I feel like she was asking if this had to do anything with like rhetorical appeal.
No, ethos is like credibility.
Yeah, it would be ethos. It's like credibility, like they're using somebody that you want to listen to versus using like pathos with emotion or like logos with like logic and numbers.
Okay.
They use numbers. They use ratios.
Oh yeah, the 1 in third, like every 1 in third student athlete is correct.
Yes, so I love it. That's getting into the psychology of this, right? And I love that you all are thinking in that way, because yes, when we're talking about messaging, you do have different types of appeals, right? So you do have your emotional appeal. Certain topics yield way better when you appeal to the emotion of someone, which is what we saw in the first PSA, right? He was really speaking from an emotional state, like, you really feel this way about me. You see this and this is your assumption about me, right? He didn't give any data about, do you know that 1 in 4 folks living with obesity have tried to diet before? Because that wasn't the goal. The goal was to appeal to the emotion of the person. And this particular ad or PSA, yes, they did appeal more to the logic as far as how you should be approaching this particular issue. And they were very more prescriptive about it. When they were talking about, you know, being fans and while it's okay to be excited in the stands, it's like, okay, I'm saying things that are logical. We know you're going to be excited. You may yell some things in the stands, but to get online and to then go into the comments, it's applying the actual logic component of it, right? So it's in this particular ad, it was less appealing to the emotion as far as saying, you know, you shouldn't make people feel bad. It wasn't very soft and somber. It was very direct, very logical, right? Very factual. Okay, so those are very good thoughts, that you all brought up, especially when we're talking about messaging, because not all topics fit those appeals. You have to figure out which ones are more effective when you do an emotional appeal versus a logical appeal, because we have something in communication that's called reactance. Reactance happens when you present so much logic that a person goes back and forth with you, contesting fact for fact. Fact for fact. But when you appeal to emotion, it has a different type of resignation, where sometimes individuals are willing to not subdue, but reduce their full dependence on logic and lean more into the emotional state that they feel as a part of the message. So I'm glad you all brought that up. That was a very good observation. So do we kind of get the gist of PSAs? They have a specific message, a specific issue, a specific audience, right? We always want to be attuned to who the messenger is to kind of help us think about why they're,